Okay, so welcome everybody to Celebrating Families Week 2022 at McIntyre. And today is our final workshop. So if you've been on the journey with us, or if you're just dipping in and out, today we're really lucky again to be joined by Jane Nichols for the second time this week. But today Jane's going to be bringing to life to you the wonderful work Dementia UK provide to families, staff and people who live with a learning disability. And Jane's so in a nutshell, that's what to expect this morning. So I'm going to hand over to you, Jane, and put myself on mute, and I'm here if you need me in any way.
Thanks ever so much, Nikki. Thank you. So Nikki's asked me to come along this morning and just sort of talk a bit more in depth around what Admiral nursing is and what the Admiral nurses do. And then I'm going to talk a little bit about specifically more around my role within McIntyre. I have got a couple of videos, so if time permits, I'd like to share those with you as well. So I'm just going to share my screen and we can hopefully make a start. Okay, so if I don't hear anything, then I will assume that everyone can see my slides. Perfect. Okay, so Admiral nursing. So a little bit about the history. So some people ask, why Admiral nurses? Why the title Admiral nurses? So the Admiral nurse got its role, if you like. It was a family of a gentleman called Joseph Levy, CBEM, who founded Dementia UK. And
okay, we'll call you back. Bye.
And he actually named the nurses. So Joseph had vascular dementia and was known affectionately as Admiral Nurse Joe, because for his love of sailing. So that's kind of where the Admiral Nurse title came from. And Admiral nurses sit within Dementia UK, who I'll speak about in a second. So hopefully, as you can see on this, so Admiral nurses are specialists in dementia care. They are specialists in terms of their knowledge, and they are supported and developed by Dementia UK. Now, we specifically provide support to family carers, people living with dementia, and also how, particularly their families. We provide education, leadership and development, and that's to many different service providers and also other colleagues as well. So in terms of numbers, so there are approximately 300 Admiral nurses across the UK, and the number is rising considerably. I think with the pressure of COVID as well, it has just really shown the level of support that families need that are experiencing dementia. We often support families through the toughest of times. As I said earlier, we work in a variety of settings. And it's often the really complex cases that we support. So again, I've got a nice little diagram Dementia UK provided that helped to show that. So the ultimate aim of an Admiral nurse is to improve the well-being and quality of life for the people caring for the person with dementia. So, because we recognise that obviously by supporting the carer, that also helps support the person who's experiencing dementia. And as we know, it can put a lot of pressure onto carers. So I think in terms of enhancing their ability to adjust and cope, so it's looking at different ways that the family can support the person with dementia, but as I say, to also provide that level of support for the person. So we can also share our knowledge with colleagues. I know within my role as a learning disability Admiral nurse, I sometimes have contact from colleagues, other Admiral nurses who may have had somebody ring the helpline who's supporting a sibling or a family member with a learning disability who also has dementia, and they may come and ask questions specifically around people with learning disabilities. So it's really about supporting each other from a work point of view as well. So we focus a lot on relationship-centered approaches, so looking holistically at the person and the dynamics of a relationship, because things change, as you can imagine. If you're looking at a married couple, you've gone from a couple with maybe sharing sort of equal values, and things may change. So actually becoming a carer for that person that you were once a partnership with takes on a completely new dynamic, and it's working that through with somebody. As I mentioned, we work in partnership with other host organisations. So a good example of that is obviously myself working within McIntyre, but I also am very lucky to be able to tap into all the amazing resources that Dementia UK provide as well. So we promote and implement best practice. So we're always looking at latest research, new resources that are out there, things that have been trialed, and if we can apply those to the people that we're supporting. I also provide education, and that can be to families, although I often say they educate me more so, but also externally to McIntyre. I do a lot of work with universities, with student nurses, to kind of talk about the role, but also to raise awareness around dementia and the people that we support. So providing psychosocial support for carers and people living with dementia, and again, that comes back to the whole holistic approach and thinking about all the different ways that dementia can affect the family and how we can provide support for that. And sometimes that's just to sit and listen, and have an understanding of what that person may be experiencing. So in terms of case management, if I speak within the organisation, as in McIntyre, so I do hold a caseload, but also do consultancy work, or so people will come and ask questions if they're concerned about somebody they're supporting, and that can be also if they suspect the person might have dementia. We can kind of go through that whole process of things to look for, and signpost, if you like, to external support. So this is one of the diagrams that Dementia UK use, and it's just to put into context a little bit of how Admiral nurses work. So as you can see, they've split this pyramid into three tiers. So initially, tier one would be where somebody is seeking information and advice. So that could be coming to Dementia UK for information. They do lots of leaflets, etc. And it could be connections with community services as well. And then tier two is more bespoke. So this is a more personal approach to supporting the person, looking at their well-being, might be looking at things like local support groups. We've got obviously memory cafes, etc. And it's not until we get to tier three is when you see the Admiral nurses come in, and that's when things become really complex. So this could be things like medication that the family are trying to either get for the person, or difficulties that they're having, maybe liaising with GP services. It could be that the person's behaviour is changing due to their dementia, and the families, if the person's living at home with them, might be struggling a bit and might need that little bit more in-depth support whilst they're at home. And this is kind of where the Admiral nurses come in. But as you can see there, it's all about supporting best practice and working with families is what Admiral nurses do. So I also mentioned a bit about working in different host organisations. So we've got a list here. So you can see, so some of the roles are within a community setting. So that can be well, we can be with all the other organisations that you can see on there. So that would be more supporting somebody that's still living at home. But also if the families are finding it difficult, then we might be able to organise with local organisations, respite care, etc. And also if they've got carers coming in, paid carers coming in, looking at help supplying training for those people in how to best support somebody with dementia. And then you can see care home. So that's really around engagement and support families in care home. And this has been really valuable over the last 2 years with COVID, because we know some of the difficulties that have been highlighted with families trying to visit family members whilst they've been in care homes, obviously because of the cross-infection side of things. But also, again, providing training with staff who might not be so aware of supporting somebody with dementia and all the things that can come with that. Acute hospital as well, so they have a lot of Admiral nurses that work within an acute hospital setting, and again that can be around supporting the families whilst their loved one is within the hospital. Also looking at supporting colleagues, so medical staff within the hospital have different approaches in terms of, well, you know, the nitty-gritty, if you like, so supporting with personal care, but also eating and drinking and things that people need to be providing extra time and support for somebody maybe that has dementia, and how they may present. So delirium as well, which can be quite a big issue within a hospital setting where infections set in and the person might appear extremely confused, very agitated, but this can relatively be easily treated if it's identified early. So it's highlighting things like that. That's just a very small example. But also facilitating transition. So if somebody's gone into hospital, say they may have had a stroke, and then actually looking at if they're returning home, how can that family be supported? What equipment do they need? You know, we do have discharge planning within hospital, but where you've got an Admiral nurse sitting within that hospital, they can also give a more detailed reflection of the sort of support that the person might require when they return home, and also the family support as well. Another area Admiral nurses work in are hospice settings. So this will be obviously when we're looking at palliative care or end of life support, and supporting the family through those difficult times. That can be supporting around what to expect at the end of life, but also preparing for it as well. So if you've got younger members of the family, and whilst we're sort of talking about end of life, as you know, or may not know, within McIntyre, they've got the Dying to Talk project, which has really complemented some of the work that I do within the organisation. With that joined up working has been very, very valuable. So, and again, within the hospice setting, it's really just raising the awareness of specialist support for people that have dementia. And often dementia is not seen as a condition that is either terminal or, you know, so people don't often realise that they are entitled, if you like, to get support from hospice settings, and that can even be in the way of therapies or just respite for the family. So again, that's something that the Admiral nurses try to highlight. Now, the next one on that list is Admiral Nurse Clinic. So this can be a drop-in clinic, so within a community setting. So you would have a regularly run clinic that people can come to, ask questions, but also seek advice on more complex issues that they're experiencing. And we see this work quite nicely within memory cafes, where we try to have an Admiral nurse present, and if a family member comes in or the person with dementia and they want to talk, then we often make sure that there is a quiet area or side room where they can have that opportunity to sit and talk to an Admiral nurse whilst they're attending the memory cafe. So that, in terms of, the clinics can also sit within GP surgeries as well. I've tried to run I have run virtual clinics during COVID. So in my particular role, so staff teams can make contact, come and ask questions, etc. And that's worked really well over that time frame. And then the last thing on there, as you can see, is the Admiral Nurse Dementia Helpline. And this is an amazing resource, and one that I always share with teams when I'm out there as well, because they work 9 till 9 Monday to Friday, and then 9 till 5 on a Saturday and Sunday. And they are there to answer questions, provide advice, link signposts to other organisations that may be able to help, and also just to listen. So if a carer rings up really, really stressed out and they just need someone who really understands what they're going through to talk to, then the Admiral nurses are there. They do have a dedicated email address as well. So sometimes people aren't always able to get away and have that quiet time to talk to somebody over the phone. So being able to email may work better for somebody, or they have a busy life working as well. It's just another way that families can be supported. The Admiral Nurse Helpline also offers support to external colleagues as well, so any professionals, anyone in any walk of life really, to ring and ask those questions. So you've listened to me waffle on for the last 15 minutes. So the next thing I wanted to share with you is a short video, which is about 5 minutes long, and we will follow the day in the life of an Admiral nurse, if you like. I just thought it was much nicer to see that. So this is a gentleman, of the Admiral nurse that we will hear talk in a minute is a gentleman called Matthew. And we are currently looking within Dementia UK to make a very similar video of myself with the people that we support within McIntyre, just to give a mirror kind of image. So hopefully you'll find this interesting. But again, if you can't hear, please let me know.
I love my job. It's what gets me up in the morning, what motivates me. I get to really make a difference with people. I'm an Admiral nurse, which is a specialist dementia nurse, and I support families who care for people with dementia. I support around 40 carers. There's a lot of people out there that are lost and really struggling with caring for somebody with dementia, and part of my job, the bit that I really enjoy is being able to get out there and give that person some hope that things can be different and things can be better.
Hello, good morning. And how are you?
I've been working with Yvonne and Glenn for a few months now.
Glenn, it's Matthew.
Glenn has a diagnosis of Alzheimer's disease, and it's just been really trying to help them come at some of the challenges that they face from a different angle, and having somebody that Yvonne can speak to who really understands what she's going through.
Glenn having dementia, it isolates us from other people. Some of our friends no longer come around to see us because I don't think they're able to cope with the changes in Glenn's life.
Glenn's a fascinating guy. He moved to England from Jamaica when he was quite young, and he was in the RAF. He got an MBE for opening community centres.
Oh wow! Oh, the Queen was chuffed that day. Oh, I remember that.
People are often not on certain ground with recent memories, and when you talk about that person, about all the things that they've done in life, you can really see that person light up.
Going through the photographs, just seeing them has brought that enthusiasm back into his life.
Oh yes, can't remember his name though.
And he'll talk about that for days after Matthew's gone. Begins with a B, you know, so it has made a lot of difference.
He's not coming, love. Barry.
Being a carer isn't an easy task. You know, it's difficult. Knowing that there is somebody that I can rely on, and that person isn't going to say I'll do and don't. You know, if he doesn't know, he'll find out and let me know, and then there's a trust.
See you soon.
Okay, you have a good day.
You too.
There's something special about him.
In the Wakefield area, there's about 3,000 people who've been diagnosed with dementia, and I'm the only Admiral nurse there. My role's been made possible through charitable donations to Dementia UK. I've been supporting Sue and Jeff since last summer, and at first things were quite mild. But around the Christmas period, Jeff had a stroke, and things have been much more difficult ever since. Hiya, Sue. Hello.
Look who's here, Jeff.
Hi, Jeff. You all right?
When Jeff came home from hospital, he was really down, obviously, and depressed and unhappy, really.
Nothing is ever simple with dementia. Often people are out there doing the best, but there's just some things that they can't get past, and you know, part of my job is to help them try new tricks, new techniques, and come at something from a different angle.
I really needed a purpose for Jeff.
We talked about perhaps getting a pup and how that might impact Jeff and how it might help him get out of the house and pick his mood up, and that's where Bailey came in.
And it's worked. No biting.
Part of my role is to support people to get the help they need. Often that can be from just showing somebody who to ring or who to get in contact with.
Then there's been issues with medication, like tablets that didn't suit. I didn't have to even think twice about it because Matthew rang the GP, he rang the memory clinic, sorted prescriptions out, and things just happened. So it takes all the worry and stress out of things. Matthew's like my rock, really. He's just there. I look forward to his visits. He's getting married in July.
Being an Admiral nurse get to be a big part in some people's lives, and people say really, really lovely things to you. Yeah, it makes me very proud of my job, and it makes me really happy and excited to be doing the work that I'm doing. Hey, you alright?
I thought that was quite a nice little video just to explain, probably a little better than I in terms of what Admiral nurses do. Okay, so I wanted to talk a little bit more specifically around my current role within McIntyre. So the role was introduced after a relationship built, if you like, between Dementia UK and McIntyre. And they recognised a need for people with a learning disability who are growing older due to better health care. But with that came the complexities of more people experiencing dementia or changes that look like dementia. So between them, they came up with the idea of a learning disabilities Admiral nurse, so specifically supporting those people with learning disabilities and autistic adults as well. So some of the things that I do within McIntyre, I've done a little slide here. So I provide support for people, families, carers, pre and post diagnosis. So following along the journey, if that's appropriate with the person. I provide bespoke training to teams as well. So often I would go out and visit the teams and the person with dementia. So I know the environment, and I talk to the team to find out some of the complexities that they're struggling with maybe. And then I can go away and develop a bespoke training package for them. And now, which is lovely, I can go out and actually do that training face to face, which is really good for getting those questions together, and they can ask where they're struggling with things as well. So I do also, as I mentioned earlier, provide education to families and anyone within that person's circle of support. So we try and run different workshops, etc., for families to attend, or it's just really about making sure that I'm accessible to people and they know, how to get hold of me. Supported virtual memory cafes, that was during COVID. So we just wanted to make sure that people were still having that opportunity to link together. But now we're actually seeing the reopening of face-to-face memory cafes, which has been amazing. And it's really nice from my perspective to see how those connections work and how people benefit from those as well. So a large part of my role is raising awareness of dementia in people with learning disabilities. And I do that through speaking at conferences. As I mentioned earlier, the universities are speaking to student nurses coming through. And also within McIntyre, we've agreed to make dementia awareness training mandatory, specifically for people that are supporting those with a learning disability in different age groups that we recognise that are at particular risk of developing dementia, so that teams already have that really good understanding of the signs and symptoms to recognise. Again, I look at improving health outcomes and inequalities for people. So I would work really closely with the health team in terms of trying to increase the level of health that person's experiencing, but also looking at other health conditions that may be giving that impression of dementia, but actually it isn't. So things like hearing that's deteriorated, or the person might have developed cataracts and actually be struggling to see properly, which when you look at signs and symptoms, some of them can mirror those sort of things that you'd expect somebody to experience who has dementia. I also do quite a lot of working with external health and social care services, so that could be commissioners, GPs, community teams as well, just really sort of liaising more with that specialist dementia hat on, if you like, some of the things that the people could be experiencing. So in terms of facts and figures, so this is last year's figures, so these have changed now. I think they've increased slightly. So again, these back in 2021 were exact numbers. One thing we have found where the numbers are increasing is because people are now going back to having those face-to-face assessments for diagnosis, so which over the phone or via video link weren't maybe quite as appropriate during COVID. But as you can see there, where I talked about at-risk groups, we've got above the age 40 for people with Down syndrome, relatively high number there, and those at risk with a learning disability over the age of 50, and that's quite a high number. Beginning of this year, we worked out that 37% of the adults within McIntyre charity are within those at-risk groups. So that is a huge proportion of the people we support, and this is why we're really focusing on that kind of mandatory training, but also looking at factors such as brain health and where we can actually reduce that risk of somebody developing dementia. We're focusing more on the preventative measures as well. So some of the health inequalities that I see, and another reason why this role came about as well, was due to, as you can see on there, some of the issues. So things like the links between Down syndrome and Alzheimer's disease, we know is quite high, and you saw within the at-risk as well. So you've got 40 plus, we tend to see changes in the person's brain which is quite young. It doesn't mean that all people with Down syndrome will go on to develop dementia, but it just means they're at a higher risk. So, and another issue that we see is the assessment process as well, and it's really, they're different in every area within the UK. So there is no streamlined, if you like, assessment process. And this is something Dementia UK are trying to address at the moment, and are actually looking for a specific learning disability dementia diagnostic pathway. So it doesn't matter where you live within the UK, you would have access at the same point. You would follow the same kind of assessment process, if you like. So that is something they're working on currently. Diagnostic overshadowing is a huge issue we found within people with learning disabilities, where other health professionals might think that the way somebody is behaving could be due to their learning disability, rather than looking at, well, no, actually maybe they're in pain, you know, maybe they're experiencing hallucinations, etc. So we often have to advocate a lot for people with a learning disability, and autistic adults as well. Lack of awareness, so that also comes down to the diagnostic overshadowing a bit as well, but really people not fully understanding some of the challenges that people may experience with a learning disability, and then add dementia on top of that can make things really tricky. Postcode lottery, I think, as far as health input, health resources, it's the same for anybody, regardless of learning disability or not. Obviously, we know that depending on what area of the country you live in, you may have really, really good access to resources, and some you may really struggle. So it's kind of us highlighting those areas, and then looking at, is there something we can do on a national level to actually tap into that? So one of the ways I'm doing that, I sit on a decision-making council that feeds up into NHS England. So if we see within the organisation, and there are other different organisation members within that council, then we can express our concerns, and they may be able to tap in directly to services within NHS England to address some of the issues more locally. An example of that was a GP practice in the Midlands, and in the Midlands, and we mentioned it within the decision-making council, and were told that she could link us in with somebody from NHS England who specifically covers that area. So they could be having those conversations with the local clinical commissioning groups as to why certain services weren't being offered for people. And misdiagnosis, so coming back to that, I think, again, where I mentioned about eyesight, hearing, those kind of things that actually, you know, could be relatively easily addressed, but because clinicians aren't always skilled in terms of supporting somebody with a learning disability. I'm thinking of another scenario as well for females in particular. We found that, or we've started to look at people that might have received a diagnosis of dementia, but actually they're kind of within that age bracket where we could be looking at menopause or perimenopausal symptoms, which also do look very similar. So it's keeping all those things in mind as well. In terms of the project, so when I talk about the project, my role was a 2-year funded project, and now has been made permanent, which is amazing that McIntyre have seen the need, continuing need for the role. So the impact of the project so far, we've seen a reduction in hospital admissions, improved health outcomes for the people we support who have a learning disability and dementia. A general increased awareness of dementia within the organisation, reduction in antipsychotic medications, where somebody might have been, you know, taking something historically, but actually they no longer need as their needs change. A reduction in inappropriate DNAR, CPR orders. This was very strongly linked with COVID and people having DNA CPR orders placed when they're in hospital, but then if they're well and they're discharged, sometimes those orders don't get cancelled. So it's looking at the appropriateness of that. And one of the big things is the development of future learning disabilities nurses, because there are more, and I know Dementia UK are working with some other organisations currently into how those roles can look within their organisations. So through the project, the whole project's been evaluated, and there will be a report released probably in the next couple of months, which has actually tracked all the things that we've done with over the last 2 years and the impact that that's had. So, so that really helps to kind of evidence, I think, the impact that Admiral nursing has had within the learning disability community. As I mentioned earlier, the other things that we're going to be focusing on is brain health, so looking at healthy lifestyles, developing and refreshing the dementia resources that we have within the organisation, supporting research, which we have been doing and will continue to do, and also looking more at the people that we support and running courses specific to people with learning disabilities. So if they're sharing their home with somebody that may have dementia, actually supporting them to understand why they may see changes in that person. There's so many things. Okay, and I just wanted to share, I mentioned it earlier, but just in case anyone's interested, we've got the contact details there for the Admiral nurses. If anybody felt the need to ring, ask questions, etc. They're amazing nurses, they really are, with a font of knowledge, so definitely utilise those. And I'm sure we'll probably be sharing this PowerPoint as well on the website for people. And then I've just got a few links. So there are all the publications that we have within McIntyre. So these resources predominantly focused on supporting somebody with dementia, but also well, you can see there, you know, healthy living, eating and drinking, life story work, etc. So that's accessible to anybody on the McIntyre website. And then signposting, so they're just some resources that I use within my role, which are really useful, I think. So again, this will go out with the recording, should people want to have a look at a little bit deeper into some of the things that we utilise. And I think that is it. So contact details. I do have another very short video, but I just thought I'd sort of give an opportunity for questions. If anybody has anything they'd like to ask, then feel free.
Thank you, Jane. Thank you so much.
Okay.